Now, shifting focus to the hidden economics of South Africa's healthcare choice. Healthcare costs in South Africa are spiraling with medical aid price hikes of over 10% for 2024. A proposed NHI potentially costing 1.3 trillion rand and an unsustainable focus on reactive hospital-based care. Dr. Yaseen Khan, a co-founder and CEO of Essential Medical Guidance, joins us with insights on his perspective of how the solution may lie in strengthened primary healthcare and digital innovation. Thank you so much for your time, Doctor. Now, you say that medical care in South Africa is reactive rather than preventative. Is affordability the main driver here?
Thank you. Thank you. It's really, really good to be talking to you today. So, reactivity, right? We've all had this experience. We go into our GP's office, we go with a particular complaint, and the doctor tends to treat what is presented to them, right? The cough or the sore throat.
Yeah.
And what's important to reflect on is that the idea that your doctor may say, well, you came in for that, but you've just turned 40. I see you've got a family history of diabetes. Don't you think we should check your glucose? Don't you think we should check your lipids, and so on and so forth, right? And the challenge is that for some reason we're not getting that right, and the numbers are clear in terms of the degree of hospitalization and the degree of disease that's not picked up and managed early on well. So your question about affordability, that's really the crux of the matter. Medical schemes make available tons of wellness and screening and early chronic disease benefits that are not effectively accessed by GPs for their patients. So this ought not to be a question of affordability. It's actually in the interest of the medical scheme to ensure that these things are done, because we prevent downstream costs. So the key question and problem statement is, well, why is this not done? Why are we not accessing and maximizing medical scheme screening and wellness benefits for patients?
I mean, Doctor, you talk about, the need to scale up primary healthcare. What exactly does that entail, and where does it start?
Yeah. So what is primary healthcare, right? So we really talk about, when we think about primary healthcare, we think about the basics. We think about the first port of call that a patient should engage with when seeking health. Your doctor, but more and more your nurse as well, right? And the truth about healthcare costs and economics and the way healthcare works is, if you do healthcare well early on in the chain, if you screen, if you drive early diagnosis, and if you do these inexpensive things early on, and usually who's doing those inexpensive things? Primary care practitioners, doctors, nurses, etc. And if you do those things, you prevent the really expensive downstream consequences. You prevent the strokes that end up in hospital and ICU. You prevent the heart attacks. You can prevent the late-stage cancer. So when they say scale up primary care, focus on primary care, it's quite closely linked to preventative care and early care. And the key focus there is on, yes, as consumers and patients, we have a responsibility to undertake our own screening and take charge of our own wellness. But my key message is, we've got to leverage our doctors to do better primary and preventative care in order to scale up primary care to its actually fit properly.
And is the doorway to that digital innovation? And my second question to that is, how deep in digital innovation are we in South Africa's healthcare system? And has it actually filtered through to the public healthcare sector as well?
So digital really represents a very substantial opportunity to drive forward primary care, and particularly to ensure that care and that the approach to care is more preventative, rather than curative. Now, digital has proliferated. There are so many different technologies now available. These technologies are being picked up in the private sector. They are being picked up in the public sector as well. What's important is to ensure that we we work in such a way that technology is actually adopted and used. Now, as an example, the work that I do is really about ensuring that healthcare professionals have access to the very basics that they need to make day-to-day decisions. The company that I represent, EMGuidance, is a simple technology platform that allows healthcare professionals to access very basic resources that guide them on decisions in diabetes, hypertension, and so forth. And we've been very successful with adoption, something to the effect of 70% of doctors in South Africa utilizing the platform. And by keeping it basic and simple and saying, let's build the technology that doctors actually need in their workflow, rather than all sorts of fancy tech that may not be used. Let's first ensure that we provide them with what they need. Okay. And now that we've got that in place, the question that we're asking ourselves is, how do we leverage that? How do we leverage that presence to allow them to be more proactive, to lean into screening, and particularly to this issue that I spoke about in the beginning, how do we get doctors to maximize medical aid benefits, particularly medical aid screening and wellness benefits, by using the right tech and the right data?
All right. Well, thank you so much. We do have to wrap up the conversation. There have been really, really interesting insights there. And I guess really at the heart of it is really how do we drive down costs and make sure that we screen people early, that we scale up primary healthcare to make sure that it costs less for everybody, the consumer and also the healthcare providers. Thank you so much for your time, Doctor. That was Dr. Yaseen Khan, co-founder and CEO of EMGuidance.